morning, Roberto. Thank you to be here with us this morning. And I'm very happy to see you again. Roberto Mezzina, Dr. Roberto Mezzina, you are the main referent figure of the Basaglia School, and you have managed the Department of Mental Health of Trieste for a long time. Now you are involved in many projects with the World Health Organization, and I know that you describe yourself as a doctor who does not wear the lab coat. Is this right?
Yes, thank you. This is the sentence I said when I was invited by chance for the 40 years of celebrating the reform law of the National Health Service by the presidency of Republic in Italy. It was a great honor, but I tried to make some difference between the colleagues, among the colleagues that were there, saying that we were in a tradition of, in a way, not just challenging the medical model, but trying to develop a more equal approach to health, where the doctors can collaborate with people receiving care, because they are the protagonists of care. They are the actors there. So health can't be done without participation of the person itself and people as collective group to the issuing healthcare responses. Yes, I am a psychiatrist. So if you want, I can say something about myself. I'm a psychiatrist. I worked for more than 40 years, but the whole of my time in Trieste. So I joined Trieste when I was still a student of medicine from my hometown Bari. I joined the experience which was initiated by Franco Basaglia, great pioneer, director of Gorizia Hospital, mental hospital, and later on Trieste, which were some of the two reference experiences in Italy for the reform of mental health, with the criticism toward the practical action to dismantle the psychiatric hospitals as a form of oppression, as an institution that can hamper the rights of people which were interned. And at that time, for sure, Italian law was also one of the worst in the world, where people can lose all their rights, including civil rights, and they were interned for a long time and possibly for the lifetime. So it was a terrible situation, and it was at the same time the celebration of the impotence of care, and as well as the denial of constitutional rights. So Basaglia was the leader of this movement. He started with practical action in Gorizia and then in Trieste. Trieste was closed through a process of 9 years, and I joined by the end of this process in 1978. And I myself worked in the psychiatric hospital to close one of the wards, which was an infirmary ward with very regressed people, some of them in caged beds, so cages around the beds. And we started to demonstrate that it was possible to do something even with the most difficult people, most regressed people, that can be mobilized, activated, and then they can get out. And it was a great experience to have a holiday in the mountains in a normal hotel after two months of working in that place. So this was for me the discovery of the person.
And we can remember to everybody that the Basaglia law here in Italy was created in 1978, so it's more than 40 years ago.
Yes,
and this, I think this is a great point, because from my position, I see some touching points between the Basaglia approach and our John Beard approach, the Fountain House approach. So, and from your point of view, what are the meeting points between Basaglia's approach and the Fountain House approach? There are differences, similarities. There are possible reciprocal contaminations.
Yeah, for sure. There are many points of contact, because both are, our person-centered approach, where the person is the main resource for recovery and social integration. Of course, in the experience of Trieste and Italian reform, the services they try to amend themselves and to change and been transformed with an action where in the beginning the leaders were the professionals which criticized their role to be in a way the custodial, adopting a custodial approach to keeping people within places, while they were less involved in a real care. So and the care involved the engaging the person, the active position of the person in the process of care. So that's an important starting point. Of course, while this was a transformation of the public service, the experience of Fountain House started as a let's say private initiative, private enterprise, while it ranged a level of being a very important proposal for public health. So public health in USA and many countries adopted the Fountain House model, used the resources of Fountain House, developed partnership with your organization.
I know you got in touch with Fountain House already in the 90s with our friend and Dr. Ralph Aquila.
Yeah, Ralph was very inspiring also for us. He came also to Trieste to teach about psychosocial rehabilitation according to the model of Fountain House. Then I visited Fountain House, I think in 1998. I was impressed by the place, very much similar to a house really, and not an institution, and where people were welcoming the visitors. These are people with lived experience. So at the same time, I was developing in Trieste an approach that was based on the involvement of people using services in the provision of care. So through social clubs, through self-help groups, through recovery-focused discussion and practices. So it was very important for me to compare the two aspects, and I was also impressed by the transitional, the approach to work. Transitional employment and supported employment approach that has been developed by Fountain House, while we had the social cooperatives, which is a little bit different, but with the same philosophy.
See, exactly. And I see we have a community-based approach, so-called community-based approach, and I think also in Trieste with the Basaglia School and the cooperatives and the network between the hospital, the place where people comes, the daily centers, the cooperatives where people work, and the community around. So you also have a community-based approach.
Yes, for sure. This was the step after the closure of the hospital. At the same time the hospital was going to be closed, there was the need to develop opportunities for independent living or supported living in the community, like group homes and then individual flats for people, work with social cooperatives, and establishing, of course, a new way of providing mental health care through community mental health centers. The community mental health centers are 24-hour services, but very much home-like, where people can just walk in, ask for care, be engaged in a number of social opportunities, as well as clinical interviews, etc., medication, and the obvious things. But the issue was not to adopt a medical model per se, but blending everything in an overall holistic approach, where the person was at the center with all the needs of the person and was always engaged in a process of negotiation. So nothing with people without people. So that's was very important. And of course, the community around, as you said. So the community approach was not just simply moving care from a closed institution to a community environment, but adopting a community vision. So the community around the mental health centers was invited to come to the centers to participate as caregivers, as volunteers, be informed in the change of the vision from the illness focus to the person focused, and then the closure of the institution, etc. So many actions were done and still are done within the community to have the community participating to this change of the vision.
Yes, I think this brings us to the present, because us as Clubhouse movement and with Fountain House and with the Waterheuvel in Amsterdam and Clubhouse Europe, we are very keen on this community-based approach development. So it's really important for us to work on this issue, and I think it's really nice and it's really interesting for us to learn some lessons from the Trieste School approach, or to find some connection with you. Now, I know that you are part of the Global Coalition of Mental Health Organization. So could you describe a post-COVID global mental health landscape? What issues existed before the pandemic, which got exacerbated, and what are the new challenges?
Thank you very much. Well, I think the COVID experience, which was very hard for not just for people within institution, but particularly for them and for the general population, of course, is the realization that mental health is everybody's business. So everyone can be touched by mental health issues when there is a great distress, a great trauma that's been imposed over the society, including the measures to contain and reduce the infection and the pandemic. But the need for having proximal, let's say, services where the services can be displayed in the community was higher than ever. At the same time, the services were reduced because of the risk for infection. So there was a huge gap, and people are now suffering from this gap of care that has been suffered for over the last couple of years, particularly for young people. This is the demonstration, first, that institutions can be sources of infection, like for the elderly, but also in mental health care. In large institutions, there is a study of WHO, for instance, in Eastern Europe, where there was a spread of infection within institution, locked institution. And at the same time, they suffered of worsening the conditions of people inside, because they were isolated from the society even more. They didn't receive visits, they didn't get out, etc. So institutional responses are not the answer. And at the same time, the need for having this kind of community-based care going close to your door, providing an integrated approach that looks at the living condition, the quality of life of the person, not just a clinical approach, integrated approaches and comprehensive approaches. So this is the idea for changing mental health globally, also addressing some very important attention to vulnerable population, vulnerable groups, like people with pre-existing mental health issues, which are suffering more, people at the margin of the society, like the homeless, people like the migrants, people with suffering from social inequalities. So the gap, particularly the social inequality, was expanding, as we know, and this has an impact on mental health. So there is a huge need of a holistic approach that includes responses to the mental health needs, as well as the social needs of the person, the social roles. So that's why Fountain House can be so important in this area, to provide practical and concrete responses to these needs. I think this is some of the ideas around the coalition is an idea that started from grassroots organizations like the International Mental Health Collaborating Network, which I am chairing, the World Federation for Mental Health, and others like the WAPR, etc., involving Clubhouse, International Fountain House, and others. And now it's a component of, also for Europe, of a platform for European platform, a mental health network provided through the WHO Europe, which is just at the beginning now, but it looks promising. Of course, the risk is to have such a huge component, number of components, and so to have to spread the approach in many little things and not have an overall impact. But we try to do something in a practical term.
Thank you so much, Roberto. You know, we as Clubhouse movement on a worldwide range, at the beginning of COVID pandemic, we started a huge research on ourselves, how Clubhouse has reacted to the lockdown situation, to the COVID-19, how our members reacted and what kind of services we provided to them. And let me tell you, I'm very proud. We can say that 100% of our clubhouses kept services active to support members when they were at home through internet. But also many clubhouses keep a door open for to prevent psychotic crisis, to prevent bad situations. So none of our members were left alone. And we did study it because while there was the pandemic, we sent a questionnaire to our clubhouses, and then the University of Massachusetts State helped us to do this research. I will send you some documents about it. Because especially here in Italy, I can tell you, at least in Rome, many daily centers closed down, and a lot of doctors couldn't even see their patients. So many of our members felt really alone, and it was really important that the clubhouse could serve them in a way or the other. And I think this demonstrates that just what you were saying before, that to keep on with the institutionals, to keep people inside institutions is not the right answer, and it's really important to promote a community-based approach. And I think this is really, really important.
I completely agree. Of course, loneliness and social distancing, social isolation is one of the worst consequences of the pandemic, apart from the trauma, of course, of the pandemic itself. But the paradox is the services were reduced. Services were so important to provide social connections, therapeutic intervention, therapeutic relationships, caring relationships in general, and so the importance of the NGOs, of the volunteer sector became more and more evident. So it's very important that this can be a co-production between the public services that must be encouraged to keep their role, and we disagree with the decision of many services across Italy to close the provision. It was too much defensive choice, but I think we interested services were going on to provide care door to door with the support of social cooperatives, for instance, which were very active in providing food and practical help, as well as supporting the so-called clinical care. So I think this is very important, what you said. It's important to have these initiatives in the community that are keeping the links, keeping the connections and the bonds with the people which can be isolated in their life and in their homes.
Yes, it's an important lesson we learned with the COVID-19 pandemic. So, dear Roberto, I finished here my time, and my question for you was very, very important to meet you, and thank you so much for allowing me to ask you those questions and for your answer. We really enjoy it.
Thank you. Let me remind finally that the human rights perspective is so important today. I think you are doing this by providing the supports to people and job placement, social integration, social inclusion. So the right to have a life in the community at the highest level of independency and health. And I think this is a great support that Clubhouse and Fountain House can provide to the international movement, as well as our little experience, but can still have some important lesson to tell people in this field.
Thank you so much. I thank you from the leadership training that we are having in Amsterdam today, and I thank you from the Clubhouse Europe movement and from Fountain House, of course. I hope to see you soon in person.
Okay.
Okay.
Very good.
Very good. Ciao, Roberto. Thank you so much.
Ciao.
Ciao, ciao, ciao.